In late 2019, a new virus emerged in Wuhan, China. It caused a respiratory illness, COVID-19. People experienced fever, cough, and difficulty breathing. The virus spread quickly in Wuhan, overwhelming hospitals. Scientists identified the virus as a novel coronavirus, similar to SARS. It likely originated in bats and spread to humans through an intermediary animal. The Huanan Seafood Wholesale Market, where live animals were sold, was identified as a possible source of the outbreak. The World Health Organization, or WHO, was alerted to the outbreak in December 2019. Chinese authorities worked to contain the virus, but it was already spreading beyond Wuhan. Travelers carried the virus to other countries, raising global alarm. As COVID-19 spread rapidly across borders, the WHO declared a public health emergency of international concern. The virus reached every continent, infecting millions. Countries struggled to contain the outbreak. Italy became an early epicenter, with its healthcare system overwhelmed. The United States soon followed, with cases surging in New York City. The virus did not discriminate, affecting people of all ages and backgrounds. Fear and uncertainty gripped the world as the death toll mounted. Hospitals were filled with critically ill patients. Lockdowns and travel restrictions became the new normal. Countries implemented unprecedented measures to slow the spread of COVID-19. Lockdowns confined people to their homes, shutting down businesses and schools. Social distancing guidelines were enforced, limiting gatherings and encouraging mask wearing. Healthcare systems were stretched to their limits. Doctors and nurses worked tirelessly on the front lines, facing shortages of personal protective equipment, or PPE. Testing capacity increased, but access remained a challenge in many areas. The pandemic had a profound impact on daily life. Schools transitioned to online learning, disrupting education. Businesses closed or adapted to remote work, leading to economic hardship. Social interactions were curtailed, leaving many feeling isolated. Amidst the challenges, a glimmer of hope emerged: the rapid development of COVID-19 vaccines. Scientists around the world collaborated at an unprecedented pace, utilizing new technologies to create effective vaccines. Within a year of the outbreak, the first vaccines were authorized for emergency use. Distribution began, prioritizing healthcare workers and vulnerable populations. The vaccines proved highly effective in preventing severe illness, hospitalization, and death. While the pandemic is not over, the development and distribution of vaccines marked a turning point. As more people get vaccinated, the hope is to achieve herd immunity and a return to some semblance of normalcy. However, the virus continues to evolve, and new variants pose ongoing challenges. The world has been forever changed by COVID-19, and the lessons learned will shape public health policies and pandemic preparedness for years to come.